Hello, my beautiful people. Thank you once again for coming. If you're returning and if this is your first time watching a video of mine, thank you, and I hope you stick around. So, subscribe and join us. My name is Miriam K, and the video I'm doing today is about exchange blood transfusion, EBT, which is not like the normal transfusion. This one involves some of your blood being taken out, most of it, and replaced with non-sickle blood for us people with sickle cell. So I am on a routine EBT. So mine is pre-planned, pre-arranged, and I do it every 6 weeks. And in between, if I have any issues or I get anemic at any point, I can also get top up in between if needed. But most of the time, the 6 weekly works for me well. I usually get 8 units of blood when I get my EBT done, and there are different reasons for doing it. For us that have sickle cell, most of the time is to manage our pain better, reduce the number of crises or the severity of it. And also for those that may have suffered from stroke, it also helps, so they use it for that. And just to make a disclaimer, not everyone that has sickle cell requires or needs the exchange blood, needs to be on the exchange blood program if they don't require. So everybody, as an individual, our cases are assessed differently. So just because this works for me, it doesn't mean that's what somebody else is going to have. And there are a lot of people that are on hydroxyurea instead, which pretty much kind of does the same thing overall to try and manage crisis. So I'm not a medical professional. This is not medical advice. This is just based on my experiences. And yeah, so the video shows the process of it, from going into the hospital and everything that's involved. But in this particular exchange, the video that you're about to watch, I had an incident whereby I experienced bleeding from the femoral line after the procedure was already finished, and this is my second time going through it. The first time it was very traumatizing, but this time I was able to deal with it better. But these are just some of the risk involved in doing such. Bleeding is one of the risk, and even before you start, they explain that to you. It doesn't happen often, but to some people like myself, it does and has, and it can be pretty scary when it does. But luckily, I'm always in good hands with my medical team, and they take care of everything. So yes, just watch. If you have any questions, please always feel free to ask me. I'm an open book when it comes to anything to do with sickle cell and things like that. I'm an open book, and I'm here and willing to assist in any way. I'm no doctor, so any advice I give is just based on my experiences, on my knowledge, living with the condition, not from a medical point of view. I'm going for my blood exchange transfusion today, but I'm already running late because I have to drop the kids off. First time daycare, so yes, I'm running late. Yeah. I'm already so exhausted. But I'm next to the next to the hospital now anyway. Guys, hospital. I'm so exhausted. I swear I feel like I could just faint. I'm so tired. The weather, British weather, of course. 1 minute it's hot, then it's cold. It's just a bit cold. So it's never easy though, having to balance your family, kids, and your health. That's just like ongoing and unpredictable. But hey, what can we do? We're grateful for life. That alone is worth being grateful for. So it's not like I'm complaining, because others who wish to be here to have that kind of opportunity and they don't. So I'm at the hospital now anyway. This break, I swear I wish somebody could just carry me. So I'm that exhausted, like literally. Really I'm here now, so yeah. So I have to check into the gown. Got my patient details. This is the machine. Had my obs checked. And this is the machine. But the blood is not there yet. So usually I don't have sedation. I just get local anesthetic and Antinox. There is the sedation. It just takes a lot. You have to be. So that's the Antinox. Because with the sedation, you have to be on a 12-hour fast without food and 6 hours without drinking. That doesn't work well for me because then my stomach starts to hurt. So, and also with sedation, you're so sleepy and everything, and I need to be able to check on my kids after or during the procedure, during the exchange process. I like to check on my kids and do whatever I need to do. So whereas sedation, you're literally sleeping like throughout. And also I've had some experiences that were quite scary, so I like to make sure I'm awake when everything's going on, because I've had some scary situations with my exchange, you know, and bleeding, passing out, a lot of things that I need to be awake to make sure I see everything that's going on. Not that I don't trust, of course I trust the team very, very well, but you just know that worry. Because one of the incidents even led to me having PTSD, post-traumatic syndrome, after I had some bleeding and passing out. I ended up going through so much, having panic attacks, all of that. So now, although I'm scared to do it, but at least it helps. It helps because I'm so exhausted. But when I get the exchange, I'm a bit more energetic, and I especially now that the kids are going to daycare. I have to be waking up early to drop them off. I need all the energy in the world to do that. So yeah, I'm just tired, and I'm in pain. I've not even started. That's usually how it is, boy. And sometimes by the time you finish, my back is hurting so bad. Just in the treatment room waiting for the clinical specialist to come and do the femoral line, which is where the blood goes through and comes out. Mine comes out and the other blood, donated blood, goes in. Yes, I'm just waiting for them. It's quite painful when they're doing it because I do use sedation, so local anesthetic. And my issues, because I've had so many exchanges, I have sometimes carrying around. So even when they get it, they have to really push to get the line in. Yeah. Fortunately, they have not been able to find the tube that attaches to this for the internox. So they haven't started, and I'm hungry because I wasn't even able to eat. So I'm just using that time to eat something while I wait. This is me in the treatment room. It's so funny today. I was living with the kids, and my husband was like, so by the time I see you in the evening, you will have fresh blood. I'm like, does this guy think I'm a freaking vampire or mosquito? I was just laughing. I'm like, not today, dude. Not today. Leave me alone. About fresh blood. Understandable. Oh my God, I don't understand. Hopefully, this is not painful. But at the rate at which this is going, I gotta go pick up my kids. Like, I just hope they can stop. Let me go sit here and let you know. Let me find something good. And I'm sitting here counting the ships in the cloud. That's all the stuff that they're gonna use. The needles and knives that they're gonna use to cut. I usually get mine done with my femoral line. So it's in the groin area. Some people get it done there. Even some people their neck. That one is there. At least with their scarring. It's not something that you see all the time. So there are all stuff that they use. So just stay. Yeah.
Hello.
Hi, Donovan.
Hello, Mariam. You alright?
Yeah. So I think they're trying to sort out the tube for the internox. I also want to use this as an opportunity to really raise awareness about the importance of blood donation. There are so many hundreds, even maybe thousands of people in situations similar like mine, suffering with sickle cell, many other conditions that are in need of blood constantly. And not enough is being donated, especially within the Black and ethnic minority community. Not enough donors are out there giving blood, and people don't realize how much is so important and how many lives are being saved, like my own, because of blood. And I'm going to put the information and a good friend of mine who also has a sickle cell foundation, Sickle Can, has been doing a fantastic job, Kenny, just raising awareness about this issue and getting people to actually donate blood. And they have various blood banks around in and around London. And I'm going to include information on all of that. So please, it's very, very important to donate. Your blood can literally save somebody else's life. Something that will take you few minutes to do can save somebody's life, and it doesn't take anything away from you. You still are able to go on and be normal. It doesn't affect you in any way. So, and I understand a lot of people have needle phobias and things like that, but there are so many ways to get around that. They have numbing creams and sprays and things like that for somebody who may be scared of needles. So please let that not stop you, because we need more of you guys donating blood to be able to help us that are constantly in need of it. Thank you so much, and all the information will be included.